Hello and welcome to Askimo TV. We're talking today to Dr. Krishna Moorthy. Dr. Moorthy is a specialist in bariatric and upper gastrointestinal surgery. Hi, Dr. Moorthy. How are you?
Hi, Joanne. Nice to talk to you today.
Lovely to be talking to you too. Dr. Moorthy, let's talk today about bariatric surgery. So what is the surgery?
Bariatric surgery is, in a very simple way, is derived from the word bariatrics, which essentially means the treatment of obesity. But increasingly, it's being associated with surgical solutions to excessive weight. And so bariatric surgery is a specialty in surgery that deals with the surgical treatment of excessive weight.
Who's an eligible candidate for this surgery?
There are some strict criteria that have been stipulated by expert bariatric surgical groups around the world. And people with a BMI of more than 40 or people with a BMI of more than 35 with obesity-related illnesses such as type 2 diabetes, high blood pressure, obstructive sleep apnea. These are the people who are eligible for surgery. But I think it's important for me to clarify what BMI is, first of all. BMI is a measure of one's weight, and it's calculated in a very simple way. It is the weight in kilograms that's divided by the square of the height in meters. So if I am 75 kilograms and I'm 1.6 meters, my BMI would be 75 kilograms divided by the square of 1.6 meters.
What are the advantages to this surgery?
So a large number of patients that I see, and I'm sure it's the experience of nearly everyone in this world, when you go on a diet, it's easy to lose weight. When I say easy, one can usually lose at least, say, 3 to 5% of one's weight with dieting. The problem with trying to lose weight is not the actual loss of the weight, but is maintaining the weight loss. And that's where bariatric surgery comes in. There are different treatments for obesity. Dieting is one of them. Lifestyle, such as exercise, is another way. Another way is to take some medications that are available to help patients lose weight. However, with any of these, the moment you stop doing that particular thing, such as dieting or exercise or taking medications, one tends to put the weight back on. With these surgical solutions, what happens is that one can maintain their weight loss for 10 years, 15 years, and as far as we know, maybe even 20 years.
What does the surgery involve?
There are different surgical procedures that are commonly performed, but the most simple ones, the most commonly available ones are what are called the laparoscopic adjustable gastric band, the laparoscopic sleeve gastrectomy, and the laparoscopic gastric bypass. All these procedures under the hands of expert surgeons and in expert centers are all performed by the keyhole technique, which usually consists of just 4 or 5 or maybe 6 very small incisions on the abdomen. And all these procedures are done slightly differently. So if I can just very briefly elaborate, the laparoscopic adjustable gastric band consists of placing a soft silicone band on the top of the stomach. And when that band is filled up, what it does is it constricts the stomach and divides the stomach into a small pouch above the band, and then you have the rest of the stomach below the band. And the way it works is actually quite simple. When that small pouch above the band fills up, patients feel full and they have to stop eating. The sleeve gastrectomy is a procedure that's probably been around for the past 10 years, and it essentially consists of cutting away, removing about 70 to 80% of one's stomach and leaving the stomach as a very narrow tube. And it works, the principle is similar to a gastric band, whereby because that stomach is so narrow and small, the patients, when they eat food, they feel full very quickly and they have to stop eating. The gastric bypass is slightly more complex. In this, the stomach is divided into 2 parts, and there's a small pouch on the top, and the rest of the stomach stays in the body. So unlike the sleeve gastrectomy, it's not removed. And then we surgeons take a bit of bowel, and we pull it all the way up and we join it to the small stomach pouch. And the way it works is, obviously, because the stomach is now a very small pouch, there is a restrictive element to it, but also because the bowel being joined to this pouch, the bowel that normally would do the digestion and the absorption of the calories, it doesn't do that anymore. So it's got what's called a malabsorptive component to it. And that's how the gastric bypass works.
And Dr. Moorthy, just to end off, what are the possible risks or complications to these types of surgeries?
All these surgeries have a small complication rate, but we need to put that into perspective. The chances of dying from a gastric band, I think, are negligible. It's less than 1 in 1,000. And the chances from dying from a gastric bypass or a sleeve gastrectomy, probably less than 2 to 3 in 1,000 in expert hands and in expert centers. And the mortality rate, I would say, is comparable to having a gallbladder removal. But the complications vary with the procedure. With the gastric band, the complications really are band infection, band slippage, where the band can slip up and down the stomach. And with the gastric bypass and the sleeve gastrectomy, the complications that occur about 2 to 3% of the time are leakage and bleeding.
Thank you, Dr. Moorthy. Thank you so much for talking to me today.
Pleasure, Joanne.